John Dramani Mahama, as he enters with his team after that will stay standing and then we'll get the national anthem.
I missed it.
Good morning, everybody.
Good morning, sir.
Thank you. Shall we be seated, please? Good morning, Your Excellency. Prez.Mahama, President of the Republic of Ghana. I'd like to also welcome the Chief of Staff, Office of the Vice President, Mr. Alex Sebefia, Deputy Chief of Staff, Stanislav Koisedrobe. We have the Ministers for Health, Pabna Kando. We have the Minister for Trade, Agribusiness and Industry, Elizabeth Ofusujari. We have the Minister for Gender, Agnes Namumolate. We have a number of dignitaries gathered here this morning. We have members of Parliament. We have presidential advisors and aides. We have the CEO of the UGMC who is hosting us today, the CEO of the National Health Insurance Authority. We have heads of agencies, our development partners in health. We have members of the task force and allied groups, the GMA. We have Ghana Registered Nurses Association, Corporate Ghana, distinguished guests, ladies and gentlemen. Of course, we have members of the media also present. You're all welcome. Also, if you're joining us live on radio, television, and all our online platforms, it's my great honor to welcome you to this significant occasion, the launch of the Ghana Medical Trust Fund, what we all know as Mahama Cares. I was hoping to get a round of applause for that. Well, a little backstory. About a month ago, 11 distinguished men and women were put together. They were carefully selected to make up a task force to brainstorm and engage over 3,000 persons, I'm sure you are one of them, on how to make the Mahama Cares dream become a reality. Reason why we are gathered here today. And of course, it's very significant that we are gathered at the University of Ghana Medical Center. I bet you know why. This is a 4-star health facility, and it saw the light of day under Mahama Chapter 1, a center which seeks to deliver, and of course it's a center that seeks to deliver world-class service to each person, devoid of your race, class, color, or even political affiliation. Today we gather at this historic center to witness the presentation of this particular report and of course launch Mahama Cares. Well, today's event is a formal presentation of the task force report, and His Excellency will be receiving it on behalf of you and I, the people of Ghana. At this point, I won't say much and give much away. Let's welcome the man who starts with the burden of making sure that this dream actually becomes a reality. He was one time a ranking member of the health committee, and he was preparing to become the health minister. The MP for Jaboso, please, let's welcome the Minister of Health.
Thank you, MC. The President of the Republic of Ghana, His Excellency John Dramani Mahama, members of the diplomatic corps, country representatives for the health sector development partners, heads of agencies of the Ministry of Health, the chairman and members of the Medical Trust Fund Task Force, distinguished partners from the private sector, colleagues, members of parliament and ministers, our friends from the media, distinguished ladies and gentlemen. all protocols observed. Permit me to welcome you all to the official launch of the Ghana Medical Trust Fund, also known as the Mahama Case Initiative. This marks yet another groundbreaking intervention from the government of His Excellency John Dramani Mahama, reflecting his deep empathy for individuals grappling with the burden of chronic non-communicable diseases in Ghana. You may recall that the establishment of the Ghana Medical Trust Fund was a key promise made by the then candidate, His Excellency John Dramani Mahama, and a central pillar of the National Democratic Congress Manifesto during the 2024 election. Today, we are gathered here to witness the fulfillment of this vital promise, a bold step towards greater equity and compassion in healthcare financing. The fund not only provides a long overdue lifeline to those burdened by chronic illness, but also positions Ghana as a leader in innovative, people-centered, and compassionate healthcare reform. Your Excellency, ladies and gentlemen, available estimates from the World Health Organization indicate that non-communicable diseases remain a leading global health challenge, responsible for 75% of non-pandemic related deaths worldwide in 2021. The WHO further reports that low and middle income countries continue to bear the heaviest burden, accounting for 73% of the NCD related deaths, primarily due to cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. In Ghana, the situation remains critical. NCDs account for approximately 43% of all-cause mortality, with a significant rise recorded between 2012 and 2023. Today, they rank among the top 10 causes of death. Alarmingly, individuals aged between 18 and 45, the most productive segment of our population, constitute over 50% of the NCD cases, impacting both public health and economic productivity. Facility-based data from our 3 teaching hospitals show that the average annual treatment cost for NCDs is approximately 53,000 Ghana cedis per patient. This financial burden severely strains households, with over 60% of affected families facing catastrophic health expenditures. Furthermore, individuals diagnosed with chronic diseases have a 75% likelihood of falling into poverty within 5 years. Those battling kidney and cardiovascular diseases in particular spend between 70 to 95% of their total non-food expenditure on healthcare, a clear indication of the devastating economic toll. Such a situation poses serious risks to public health and demands urgent attention. It must not be ignored. Swift and decisive action is crucial to mitigate its impact and safeguard the well-being of our communities. The Ghana Medical Trust Fund, the Mahama Cares Initiative, offers a transformative opportunity to protect lives, preserve dignity, and strengthen our health system. A recent survey involving over 3,300 Ghanaians reflected strong public endorsement of the fund. 79% of respondents deemed it necessary, and more than half expressed willingness to contribute monthly. The overall objective of the fund is to mobilize resources to finance and support the treatment of non-communicable diseases. It focuses on covering the cost of treating chronic conditions, including cancers, diabetes, hypertension-related complications, cardiology issues, chronic kidney failure, and stroke at the specialist level. Support will be selective, targeting the gaps not currently covered by the National Health Insurance. In addition, capacity building initiatives are being pursued to expand access to specialist care with a strong emphasis on early screening and diagnosis. As a ministry, we reaffirm our unwavering commitment to achieving universal health coverage for the people of Ghana. The Ghana Medical Trust Fund aligns strategically with our key sectorial policy frameworks including the National Health Policy 2020, Ghana's Roadmap for Attaining Universal Health Coverage 2020 to 2023, 2020 to 2030, the Essential Health Services Package 2022 to 2030, and the National Policy on Non-Communicable Disease 2022. We pledge to ensure the full implementation of this visionary initiative, enabling the people of Ghana to reap its maximum benefit under the inspiring leadership of His Excellency John Dramani Mahama. Your Excellency, ladies and gentlemen, today also marks the achievement of 3 major milestones in the establishment of the Ghana Medical Trust Fund. First and foremost, the task force integrated to guide this process has successfully completed a comprehensive policy document detailing the operational and management framework of the fund. Secondly, the draft bill for the establishment of the Mahama Care Fund is now ready and will be submitted to Parliament immediately after the recess. Most importantly, as the primary obstacle, the capping of the National Health Insurance Fund has been removed. This significant development has unlocked substantial resources, ensuring that a dedicated allocation of funds will now support the full-scale operation of the Mahama Fund. These developments demonstrate our seriousness of purpose and commitment to the health and well-being of the Ghanaian people. As Minister for Health, I take this opportunity to call on all heads of agencies under my ministry, along with all collaborating institutions whose mandates are critical to the successful implementation of the Ghana Medical Trust Fund, to offer their full support and collaborate closely with the Ministry of Health. Together, we can ensure the successful realization of this transformative, life-changing initiative. Ladies and gentlemen, as I conclude, allow me to express my heartfelt gratitude to His Excellency John Dramani Mahama for entrusting me with the honor of facilitating the design and implementation of this groundbreaking health initiative. I remain optimistic that the people of Ghana, and indeed future generations, will cherish and appreciate the immense impact of this remarkable legacy. I also wish to express my sincere gratitude to the task force under the distinguished chairmanship of Reverend Professor Emeritus Seth Aidi, and to all the technical experts whose invaluable expertise made the design of this sustainable trust fund possible. Further appreciation goes to the drafters of the bill and the dedicated staff of my ministry who worked tirelessly towards the realization of this visionary project. Finally, I extend my deepest thanks to the many Ghanaians who voluntarily participated in the national survey and expressed their unwavering support for this life-changing initiative. Your voices have been instrumental, and I assure you that we remain fully committed to serving you with dedication, placing your needs at the very heart of our efforts. On this note, I leave you with these words, and I quote, "When we invest in NCD financing today, we ensure a healthier and wealthier tomorrow." Your Excellency, at this point, permit me to invite Professor Seth Aidi to give a very brief remark. Thank you.
Your Excellency, President John Dramani Mahama, my very good friend, distinguished ladies and gentlemen, members of the task force, I deem it a great honor to be asked to speak on this historic occasion. Honorable Minister has already summarized our report. You will find data, you will find graphs that tell about the suffering so many people. But what you will not find in that report are the stories of these people who have been captured as data. People who are broken, whose homes are shattered. These stories broke our hearts. These stories touch us deeply. And I know His Excellency the President will move from resetting our minds to resetting our hearts through this initiative. As a task force, on many occasions as we heard the stories of patients who are suffering through chronic diseases, we wept. Our hearts were moved, we wept. Our hearts were broken by the state of their lives. We wanted to do everything we could to help. We also wanted to mobilize as many Ghanaians as possible to support His Excellency the President. There is a story that I'll share with you to end my brief remarks. And this is a story which is referred to as the starfish story. Some of you may have heard about it. In this story, a storm had washed ashore thousands of starfish. There was a young lady, young girl, who walked the beach and would find the starfish and throw it back into the ocean. Many watched her in amazement. An old man who saw this lady called her and wondered why she was doing that, because there are thousands and thousands of starfish and she wouldn't be able to save them all. Then this young girl, getting discouraged, bent down and took another starfish and threw it into the ocean and said, "This one counts." And soon the old man joined her. And then all those who were looking on also joined. And before long, they had moved all the starfish back into the ocean. Your Excellency, God has used you as an instrument to move or begin to move the hearts of Ghanaians and friends of Ghana and your friends and families to give and give and give and give, so that every single person with a chronic disease will rejoice, will have hope. We can save as many of them as possible so that they can get back to work. In Exodus chapter 2 verse 9, something significant happened. Moses, who had been put on the Nile in a basket, was seen by Pharaoh's daughter. And then, to cut a long story short, Pharaoh's daughter wanted a nurse to look after this baby for her. And Mariam, the sister of Mary, went and called Jochebed, the mother of Moses. And when Jochebed came, Pharaoh's daughter said to her, "Take this child and nurse him for me, and I'll give you your wages." Your Excellency, you entrusted to us this beautiful baby that you birthed. And we have nursed that baby for you. We are not asking for wages. Rather, as chair of the task force, on behalf of my family, myself, we are presenting an adoring gift.
Wow.
Wow.
A token gift. May this be the beginning of greater things to come. May God bless our nation Ghana. May we all obey the command of our Lord Jesus Christ. And he said, "This is my command, love one another. Greater love has no man than this, that the man lay down his life for his friends." John 15:12 and 13. On this note, the Excellency, thank you very much. Humbly ask that members of the task force stand. I think some of them are right. Please stand. Stand and I could sleep soundly because they were there to work morning, afternoon, and evening, and midnight. Thank you all very much. God bless you.
I think we ought to give the task force another round of applause. And then also thank CSOs, members of the Parliament Select Committee on Health. Also, we are told you did a good job on this. We also have members of the Ministry of Health, the Ghana Health Service, amongst others. And of course, I must also say that we are live everywhere. Ketsy, the Minister in charge of Government Communications, Phyllis Kwachiofusi, is also in our midst. At this point, we'd like to take remarks, brief remarks from carefully selected groupings. We will take, first off, from Professor Richard Adanu. He is a rector, Ghana College of Physicians and Surgeons. Please, just welcome him.
Your Excellency, President of Ghana, John Dramani-Mahama, the Honorable Minister of Health, Naminta Kando, observing all the protocols that have been well established by the Minister of Health, I thank the organizers of this gathering, this historic event, for asking me to speak briefly. I'm here on behalf of the heads of agencies of the Ministry of Health, and especially on behalf of the directors of the postgraduate specialist training colleges, to say that just like Reverend Professor Aite said, His Excellency has brought the baby out. He's created the legal environment for this Mahama Cares initiative, and the task now falls on us as heads of the agencies of the Ministry of Health to make sure that this works. So I'm here to say on behalf of all the heads of agencies that we are committed to making sure that this Mahama Cares initiative works and that Ghanaians feel the full benefit of this. I'm here especially representing the postgraduate medical colleges as we talk about this, because for this initiative to work, we need specialists to provide the leadership. And many people appreciate the work of specialist doctors and talk about that. But many of us are a bit blind to what specialist nurses and specialist pharmacists do. But then I'd like to just let all of us know that we need specialist nurses, we need specialist pharmacists, and we need specialist doctors to make sure that this is delivered. This is not a thing that is done only by doctors, it's done by the whole healthcare force. And whatever is being done to make this initiative work should not selectively choose some members of the healthcare force. It should cover everybody equally. Having said that, I'll talk about what I know. We at the Ghana College of Physicians and Surgeons have done some analysis, and we've realized that we need about 6,500 additional specialists for us to be, of all categories, for us to be able to deliver the kind of care that is needed by 2030. Currently, we have about 2,000 specialists in training in the country. So there's quite a bit of a gap. However, mathematically, we can actually halve this gap if all regional hospitals in the country are fully delivering postgraduate training. And would like, Your Excellency, now that we have your ear, to ask you to lean on the Minister of Finance and all other people involved to make sure that this is delivered during Mahama Chapter 2. We believe that it is possible in 4 years to have all the regional hospitals fully delivering a certain set of postgraduate programs. And if we do that, we can increase the number of specialists in training currently from 2,000 to 3,000. I mean, that's a 50% increase, and that would be very good. We would like to have all hospitals equipped with mini simulation centers. I mean, in other words, labs where they can go and practice on how to deliver their services and not necessarily practice straight on patients. And then, in addition to that, have 4 simulation centers over the whole country. We currently have 2. There's one here at UGMC, there's one at University of Health and Allied Sciences. And if we deliver 2 more, Your Excellency, we will fill this country with specialists. So I end by asking for the support of your government and your office to get this to happen. And have no doubt at all, we are fully committed to delivering this initiative. You have created the appropriate legal environment, and we are committed to working on this. Thank you.
Thank you very much, Professor Odili. At this point, I would like to invite Corporate Ghana, of course, because of their immense contribution that we are expecting from them. I think that this applause should be actually bring down the roof at this point. Please, ladies and gentlemen, let's welcome the corporate banking head for CalBank, Kwejo Arize. He will be actually speaking on behalf of Corporate Ghana. Kwejo Arize, please, let's do it once again.
Good morning, Your Excellency. Good morning. Good morning, our Minister of Health, and good morning, ladies and gentlemen. Good morning. All protocol is observed based on what's been said already. So I stand here representing Corporate Ghana, and we work with people. And I indicated that everybody here is unemployed, with our chief employee sitting. And if we don't take care of our people, we think that we're not going to be able to achieve our objectives as Corporate Ghana. This morning, I just want to draw the attention of Corporate Ghana to the need to support a healthcare that ensures that our objectives as an institution, whether in mining, in finance, in healthcare, in oil and gas, in whichever sector, is achieved. We can achieve that through working with people and ensuring that our people have good healthcare. We believe that the Ghana Medical Trust Fund is the right thing to support. It's the right policy to support. And we employing every corporate head, every institution to ensure we come to the party. This is not a one-time support requirement. This is supposed to be a lifelong activity that we all commit to. We can make it work if we all put our hands to the wheel. So I'm here calling on the support of all Corporate Ghana and everybody, every institution in and out of the country to put our hands to this to make it work. And I believe that with our over 14 million workforce from formal sectors, informal sectors, if we support this health policy, we can get the benefits and the country will be a much wealthy country with a healthy people. Thank you.
Group Head, Corporate Banking, Kujariza, thank you. And I see leadership of MTN here as well, so I'm sure that they're also committing to this. And if the applause you gave earlier for Kujo was not good enough, I'm sure you know it was not. It's time to hear from our development partners. And this time, I promise you're going to do it louder for them. Please, let's welcome the sector lead of the development partners in Ghana and Chief of Health, UNICEF, Manuel DeWiz.
Your Excellency, the President of the Republic of Ghana, John.Mahama, Honorable Minister, Heads of Agencies and Directors, Members of Parliament, distinguished guests, I'm standing on the listening protocol. On behalf of the Health Development Partners, allow me to congratulate the Presidency, the Government, and the Ministry of Health on the launch of the Ghana Medical Trust Fund initiative, a visionary step towards equitable healthcare and sustainable financing for the fight against non-communicable diseases. This initiative is in line with the vision of most health development partners, who aim to ensure Ghanaians have access to quality healthcare services, including for NCDs. As you know, NCDs are a major public health challenge that undermines social and economic development and can increase inequities within populations. Today, as mentioned by the Honorable Minister, NCDs are the leading cause of deaths worldwide. Low and middle income countries are also affected. In Ghana, the share of NCDs in the disease burden is increasing, and this is mainly due to an aging population, rapid urbanization, and changing lifestyles. Most premature deaths from NCDs are largely preventable. Through the development of multi-sectoral public policies beyond the health sector to prevent exposure to key risk factors such as tobacco and alcohol abuse, and healthy diets and physical activity. Furthermore, there's a lot of evidence that support the implementation of cost-effective preventive and curative intervention in health services. Strong leadership and urgent action are required to achieve this, and we commend the government and the Ministry of Health for their leadership. However, as always, sustainable financing remains a major challenge and requires innovative thinking, and we commend the uncapping of the NHIL for this purpose. The remarks by the Honorable Minister unveil important features about this important initiative, but we look forward to learning more. Health development partners stand ready to provide the necessary support to the Ministry of Health and its agencies to help save lives, improve the health of present and future generations, and ensure that the human, social, and financial burden of NCDs does not undermine the development progress made in Ghana in recent years. Thank you and congratulations once again for this transformative initiative.
Thank you, Manuel DeWiz. Of course, if you mention MTN, you must mention Telecel. They are also represented here as well. At this point, it's time to bring it a bit more home. When we talk about chronic diseases, many think that it is associated with just the aged. But nowadays, more and more young persons are finding themselves hit with this particular situation. Most of them have been driven to poverty as a result of the situation. I have in our midst this morning a mother and a daughter who are both living with diabetes. Ladies and gentlemen, it's time to hear the story of Janet Ashibu. Please welcome her with a round of applause. Madam Wasi, Michia Prez.Mahama, and in the chief gift any penny for you now more. Damasi Sham. Actually, I don't find so. I am any animal one was a Miss Wintina. Me a diabetic patient. And maybe brave you. You say I pay for Yari, and I know musica, only Swatchy, and only as I Area, I bet my back while I'm so. In Yano, I take a prayer. By me with the team with a crackers and Miss Wetnassi, I take a prayer. Area, report it back. A king and more prayer. And but Yamiadu, it was to meet Nassi. Until dear, the can say, Ceciano, a beer by me bansu. Ah, me busua. You solve it at any area ever pop. You better take care of. Until the big banny said, now, and boy, now, into me soon. But I did a grammar can say, yes, Bruno. I am a body. Me are meeting a hand, me a single parent. I won't collect dream. Me to be shifty. Now I do, Nakasamato. Na matama kola meso aye di mami at times dey be di kura na me na ebe nti me adis ready say ebe say ma peni enya huboa maye ma edro no na yetimi nya do na ye fa keke yare we efi yesu do say em property be preventima dia only bi no so benya edro ni bi e dia preventing Edanasi say Mahama ke blond di bayan Edanasi bebre say ya me hiraso na adwempa ayamaye say ofa bi e wo mu maye no embrem Edamasi. That's the story of Janice. Her daughter is also here, but for obvious reasons I cannot bring her up. I'll try to do a quick translation, except the such a part. But of course, she's hoping that Mahama Cares is here to stay. She highlights the situation she's faced with together with her daughter as a result of the sickness or the diabetes that they are having to live with. And they are hoping that there will be subsidies on medications for them and those living with that disease. Rather a touching story, but it's time to uplift ourselves because we know that there's a new era in chronic disease care, and that is in Mahama Cares. At this point, we've come to the time where we finally have the presidential launch of the Mahama Cares initiative, which is the Ghana Medical Trust Fund. I'll tell you something. Yesterday, the Jumara was launched. Today, Mahama Cares is being launched. Tomorrow, the National Apprenticeship Program will be launched. On Thursday, we'll have the Black Star Experience launched. At this time, you can do it. It is now my distinct honor to respectfully invite the Ejumara, the Commander-in-Chief of the Ghana Armed Forces, the President of the Republic of Ghana, John Dramani Mahama. Please, shall we rise and give him the thunderous applause as he comes on stage to speak to Ghana.
Thank you very much. I mean, the remarks by our sister here, I mean, very touching. And maybe I'll make a few remarks before I inflict the official speech on you. It mimics almost exactly what the minister said. But I want to say I can empathize with what she's going through because she's just one of many of our citizens and countrymen and women who are going through what she just talked about. And the perception was that if you were rich, there was a disease for the rich. Hypertension, cardiovascular diseases, diabetes were diseases of the rich. But increasingly, we see that it's inflicting more the persons who are much poorer and can least afford to be able to manage those diseases. And that's why the Ghana Medical Trust Fund has come at the right time. I have a personal connection to non-communicable diseases, and that is because my father died in 2001, and he died of prostate cancer. My mother died in 2016, and she died of complications of high blood pressure and diabetes. My stepmother died of breast cancer. I lost a friend and somebody who worked for me last year. We celebrated 1 year since she passed. I'm sure most of you know Mawena Dumo. She died of breast cancer. And currently, I have a staff in my office whose son is in his 30s and is on dialysis, is suffering kidney failure. And so these are not things that are far away from us. These are things that are close to us. These are loved ones that we're talking about. And so like prostatitis, and we must not see them as statistics. We must see them as real lives that we need to touch and help. But there's the even sadder story of one of my confidants and strong supporters when I started this whole political journey. He was an assemblyman and he was an executive of our party in Bole Bamboe, where I started my political career as a member of parliament. Very close to me, went up everywhere with me anytime I went back to the constituency. He was in charge of the southern zone, and so anywhere I went, he went with me. And a few years back, he started to have a problem with his kidneys. And so at the time, there was no dialysis north of Kumasi. And so if you had kidney failure anywhere above Kumasi, you had to travel to Kumasi to do dialysis. And so he used to travel from Bole Bamboe like once every week to do dialysis, go back. And the cost was unbearable. I tried to help as much as I could. Eventually, he needed more, dialysis treatment, and so he couldn't be going and coming. So he had to move his whole family to stay in Kumasi, rent accommodation in Kumasi, so that he could be close to Confanoche, where he was undertaking the dialysis. Sold his motorbike, sold his TV. And much as I also tried to support, the cost was becoming unbearable. Eventually he died. And he died leaving poverty behind because he sold all his assets to be able to look after himself. And so we had to take care to support some of the children to be able to finish school and all that. These are real stories. And that is why what we're doing today is important, because they will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care project, which we are yet to launch. Because under the primary health care, we envisage that there will be volunteers and designated community pharmacies where our citizens, wherever they live, or the CHIPS compounds, will be required to go and take their blood pressure, check their sugar, because like was said by the UNICEF director, some of these diseases are preventable. And even if they have an onset, if you detect it early, you can have a favorable outcome if it's detected early. And so the primary health care would have community volunteers who will go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level and all that. We'll have a program where women, are able to detect lumps earlier to be able to get treatment in case they are developing breast cancer, and so many of these other things. So I think there should be a linkage between Mahama Care and the primary health care program when we launch it. But more especially, a lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents in your genes, but a far greater number are lifestyle diseases. They are acquired, they are not genetic. And so if people just know, what their disposition is and they are able to make changes in their lifestyle, I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I want to thank our brother from Calbank for the very good testament he made about the need for support by corporate Ghana in this particular exercise. And I want to encourage corporate Ghana, businesses, the mines, the banks, and all the other companies that this Ghana Medical Trust Fund program is coming to help are your clients who save their money in your banks. There are clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you are giving it not just to help people, but to help your own clients and your own your customers and your own staff. And so I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because it's going to do a lot of good to our country. I want to assure Prophet Adanu that while he was speaking, the many suggestions he was throwing out, I turned quietly to the Minister of Health and asked, "Are you taking notes?" And he quickly took his paper and started writing. So, Prof, you can be sure that note has been taken of the suggestion you made. I want to thank Professor Aite, who's been my long-standing friend and mentor, for the contribution he made. Prof. Aite is a retired specialist, emeritus professor, and very well known in medical sectors. And so when he gave the envelope, for a retired pension, medical professional, I was curious to see how much they had given. And so after I took the check, I gave it to the health minister. After a while, I collected the envelope back and I peeked at it. And he won't want me to mention it, but I want to say that I was surprised at how much he's given. A doctor on pension has given $1,000. And so that should encourage all of us and encourage, the corporate institutions to do even much better. But on that note, I also, as the initiator of this laudable program, would also have to give something. And so I've pledged half a year, 6 months of my salary. I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into it. So thank you very much. Now let me inflict my speech on you. Mercifully, it's short, so you don't have to live through too much pain. Yeah. So I am deeply honored to join you this morning for the official launch of the Ghana Medical Trust Fund, Mahama Cares, as it's called, a landmark initiative introduced by my government to decisively confront the growing burden of chronic non-communicable diseases, for short NCDs. The fight against NCDs is intrinsically linked to our broader national development agenda, particularly the Sustainable Development Goals, and most notably SDG 3, which enjoins us to ensure healthy lives and promote well-being for all at all ages. Specifically under SDG 3, Target 3.4, commits the global community to reduce premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and promotion of mental health and well-being. Across the globe, non-communicable diseases, including cardiovascular diseases, cancers, chronic respiratory conditions, diabetes, and mental health disorders, remain the leading cause of mortality, accounting for over 43 million deaths annually worldwide. Worryingly, the burden is disproportionately borne by low and middle income countries such as ours, posing not only a public health crisis, but also a profound social and economic threat. Non-communicable diseases exacerbate poverty, they widen social inequality, and undermine economic development. Vulnerable populations, that is those with lower education, limited access to healthcare, and lower income levels, are currently most at risk. Addressing the NCD menace is therefore not merely a health imperative, it is essential for advancing economic growth, promoting social justice, and securing environmental sustainability. In Ghana, the picture is equally alarming. Available data indicates that NCDs amount for over 40% of all age category mortalities, and they consistently rank among the top 10 causes of death nationwide. Even more disturbing is the steep rise in hospitalized cancer cases, which jumped from 3,487 patients in 2012 to 16,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, 16,000 cases. This troubling trend is driven by a convergence of factors. One, shifting lifestyles characterized by things like tobacco use, alcohol abuse, unhealthy diets, and sedentary behavior, and also increased environmental factors. The cost of treatment, ladies and gentlemen, is not just disturbing, it can be devastating for low-income families. Estimates from our teaching hospitals reveal that the average annual cost of non-communicable disease treatment per patient averagely stands at approximately 53,000 Ghana cedis annually, and that's equivalent to about $3,300 US. Managing chronic conditions imposes crushing financial burdens on families, often pushing them below the poverty line and deepening their vulnerability. It is estimated that individuals diagnosed with chronic diseases face a 75% likelihood of falling into poverty within 5 years, regardless of their original economic standing. And so it even ruins rich people. I mean, you spend all your money trying to find a cure. Those battling kidney and cardiovascular diseases are reported to spend between 70% and 95% of their non-food expenditure on healthcare alone. Older adults living with chronic conditions spend 5 times more on healthcare than their healthier counterparts. Despite the important strides made through the National Health Insurance Scheme, it remains inadequate in fully covering NCD-related services and medications. In 2018, around 48% of all NHIS claims were related to non-communicable diseases. Yet essential services remain outside the NHIS coverage, leaving families dangerously exposed to out-of-pocket payments. It is against this background that shortly after my election as President, I directed the Honorable Minister for Health to initiate the establishment of the Ghana Medical Trust Fund, a commitment captured faithfully in the 2024 People's Manifesto of the National Democratic Congress. Following extensive consultations with inputs from over 3,300 stakeholders, the National Task Force I formed, ably chaired by Reverend Emeritus Professor Seth Aite, submitted its final report on April 10th this year. I'm pleased to inform you that the accompanying draft bill, as the Minister said, is ready and will be presented to Parliament when it resumes at the end of next month. Ladies and gentlemen, today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming cost of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatments necessary. The Ghana Medical Trust Fund will support specialist-level treatment for a range of chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, and home-based support. Support from the fund will be based on formal applications, carefully vetted, and will focus on costs not currently covered under the NHIS. The fund will operate as an independent statutory trust, governed by a board of trustees and supported by a dedicated administrative secretariat, third-party administrators, and patient navigators to ensure transparency, efficiency, and a patient-centered service ethic. Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first 3 years. And as was said, the main source of finance is going to come from the NHIL, the uncapped portion of the NHIL. It will also include direct budgetary support from government, voluntary contributions from corporate institutions and individuals, grants, donations, and will also be able to invest in order to raise income. Investment income. Strategic procurement measures such as access pricing and framework contracting will ensure that essential medicines and diagnosis are acquired sustainably. And so I spoke to the minister and asked if we couldn't encourage our local pharmaceutical industries to increase the availability of generic drugs, which are much cheaper than the imported drugs. I know because I paid for my mother's diabetes drugs, and I know the difference between the imported drugs and the difference in cost. And so if we can encourage our pharmaceutical industry to produce generic versions of those drugs, it will bring the cost much lower. I wish to commend the exceptional leadership of the National Technical Task Force, chaired by Reverend Emeritus Professor Aite, and to extend my heartfelt gratitude to all the professional associations, religious leaders, our development partners, and citizens who contributed their expertise and passion to bring this initiative to life. Your dedication has translated a manifesto promise into a tangible, life-changing reality. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare. Is there going to be a fanfare? Let me know. The last time when I was just declaring something launched, then I almost ran away from the stage. Okay, there's no fanfare. All right. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare the Ghana Medical Trust Fund, into brackets Mahama Cares, duly launched. May God richly bless all of us, and may God continue to bless our homeland. Thank you very much.
Well, there's no Papa. Please, you can take your seat. But then we got $1,000. We have 6 months' salary promise. We have any takers. Maybe. I think it's a good time to do a mini fundraiser. It's not part of the program. But with your permission, Your Excellency, do you have any takers or you want to give in to on the quiet? I'm looking at Asina Naju, Save Rabungu. Well, so his boss has given 6 months of his salary. He can't go beyond his boss. So he will do 3 months. Thankfully, there are 3 ministers. We also cannot go above the minister. Colleagues, the 3 of us here, we are doing a market. Thank you very much. Well, we have the Vice President's Chief of Staff here. We have the Deputy Chief of Staff outside. We have the Secretary to the President. And I see Corporate Ghana. I see Cowbank. I see MTN. I see Telecel. I see NHI. I see Ghana Health Service Director General. The task force, you are exempt. But if you are willing to do it, you can do so. I see the rector, physicians and surgeons also here. So any takers, let's do this quickly. The president has to leave us. Any takers. Oh, I should see. Okay, I see a young lady. How much, please? Let me write. Who's taking notes for me?
Dr. Brown, Presidential Staffer, working closely with the Ministry of Health. I also pledge a month of my salary.
Thank you so much, Doc. I'm writing. Seydou Agungo, Alaji Seydou Agungo, is giving us 500,000 Ghana cedis. Are you taking notes? Otherwise, I'll take it away. Please, any other takers? Okay, Dr. Kaba.
So, on behalf of the Ghana Health Service, of course, I cannot go beyond my boss. Also pledge 1 month of our
boss, can they go beyond you? Your boss says you can go beyond. Yes. We know their boss about the ministers. MPs are here. MPs. Let's do what our development partners are here. As for them, they are doing it already. So I see the medical association. Are we going? Going? You come later. Yes.
Ghana Medical Association will also pledge 100,000 Ghana.
All hands, please. Good everyone. Yes, my salary is scanty, but I'm promising 2,000 Ghana cedis. Scanty salary for 2,000. Yes, sir. Okay.
I'm from the Christian Persecution. Church is partnership for help. We pledge prayer for care compassion. We pledge 10,000 Ghana cedis.
Hopefully, every child will pay you. So you pay. Yes, sir. Allied professional.
Allied health. 20,000 Ghana.
Yes, sir. And this is our show.
On behalf of our nurses and midwives, we are pledging 150,000.
This may not be a church that God will see, but this one, we are following you. And take it Yes, sir.
I represent the branch of the medical laboratory group, which is affiliated to the NDC party. We donate 20,000.
Thank you. Any more takers? Let's wrap it up. Yes, sir.
Yes. My name is Maraki. I think she's director of the Ministry of Health. Now, on behalf of my colleague directors, the ministry, I also pledging support of 20,000.
Thank you so much. Chief. Looking to hear from MTN, President Calvin. You are doing it on the quiet. That's why I know that you get your Madam. Thank you so much. Two more, then I'll see you after and then take it. Please, sir.
I'm speaking on behalf of the 6 teaching hospitals. Together, we are pledging 60,000 Ghana cedis.
And then the very last one.
I'm speaking on behalf of New Crystal Health Services, the leading private health sector provider in Ghana. We are marketing now.
Okay, so at this point, we will be communicating platforms. Since we have our telcos here, they've made available platforms where you can contribute from the comfort of your home, wherever you are, you can contribute as well. But the short codes, can we give more than 50,000? The short codes, they're saying it's in Kitiana. Copyright. No, okay. Please, at this point, I'd like to welcome our hosts for today's event. At least he has given the center for us to be able to do this today. Please help me welcome the CEO of the University of Ghana Medical Center, Dr. Prez.Mahama, to wrap this all up.
In the spirit of giving, UGMC pledges 100,000 Ghana. Your Excellency, the President of the Republic of Ghana, Honorable Ministers of State, Members of Parliament, Directors of the Ministry of Health, Management of UGMC, my own teacher, mentor, Reverend Professor Aite, distinguished guests, ladies and gentlemen, it is both an honor and a privilege to stand before you today to deliver the vote of thanks on this historic occasion of the official launch of the Ghana Medical Trust Fund, Mahama Cares. First and foremost, on behalf of the Ministry of Health our health professionals, and indeed all Ghanaians, I wish to express our profound gratitude to His Excellency the President for his visionary leadership and unwavering commitment to strengthening Ghana's healthcare system. Your Excellency, your presence here today to launch the Ghana Medical Trust Fund is a testament to your dedication to the health and well-being of every Ghanaian. We also extend our deepest appreciation to members of the Ghana Medical Trust Fund Task Force, led by Reverend Professor Aite, our honorable ministers, our partners, and every stakeholder who has worked tirelessly to bring this initiative to fruition. We say thank you. Your collaboration and sacrifice have laid the foundation for a sustainable healthcare financing model that will benefit generations to come. To our medical professionals, doctors, nurses, laboratory, allied, and all frontline workers, this fund is a recognition of your service, your challenges, and your value. May it bring improved support, facilities, and motivation as we continue to save lives. To our guests, dignitaries, and all attendees, thank you for honoring this event with your presence. Your participation signifies a shared commitment to a healthier Ghana. Finally, let us not see today as the end, but as the beginning of a new chapter, a chapter in which we all play our part to support, sustain, and ensure the impact of the Ghana Medical Trust Fund. Once again, thank you all, and may God richly bless our nation, Ghana. Thank you.
So much for hosting us. At this point, we've come to the end of today's event. Of course, we are getting ready for the launch of the National Apprenticeship Program tomorrow in Tamale. Then on Thursday, we have the Black Star Experience. Please, or you can be part of it. It will be live on all government platforms. So please make sure that you follow it. At this point, we'll take quick photographs. It's time to make memories with His Excellency John-Dramani-Mahama. Your Excellency, with your permission, would like you to come up. And then the task force and the allied groups will join together with the Ministry of Health to take a quick photograph. Then, of course, we have our distinguished guests, a few of us also join. And then we can make memories. Task force, please, if you can come up. And the select committee,
what is Montana say?
Next, please.
Oh, Montana
Members of the
say.
task force, please.
Ada mo sorry ayen na e be sorry. I'm on say move am echi. Ti e ka say yen ko echi a.
Go back and get the shot.
Oh, you are using white. Oh, you are not using white. Yeah, say your come. Yeah, pass. Yeah.
Members of the Health Select Committee, please be on standby. Corporate Ghana and our development partners, be on standby as well. MPs, members of the Parliament Select Committee, please, it's your turn. Corporate Ghana development partners, please be on standby. Professor Adenu will join this one as well. And then Janet will also come up. MPs, members of Parliament Select Committee, Junior Minister can join us. Government Communications Minister can join us as well. Corporate Ghana development partners, please be on standby. Development partners, Corporate Ghana, please join us. Development partners, Corporate Ghana, please join us. Let's do this quickly so the president can lead us. NHIA, yes, Ghana Health Service, please join us. You're all our development partners. Please join us at this point. Okay, University of Ghana medical center, doctors, nurses. I know that you will not be part of this, so please be on standby. Corporate Ghana, development partners. Then we'll do heads of agencies, CEOs, all will join us shortly. The investing community will be on standby, so doctors, nurses, please be on standby. Heads of agencies, directors, CEOs, please be on standby.
Charlie, am I in the home?
Women, please, we have to go. Heads of agencies, CEOs, please join us for this final one. We have to go. Heads of agencies, we have to go. Please get to this quickly. And then we'll do the national anthem, then we can end this. Heads of agencies, chief directors, please join us. University community, doctors, nurses. At this point, the president has to leave. So let's capture the memories and let's go. Quickly, please, ladies and gentlemen, let's do this quickly. Let's do this orderly, please, and stand by for the national anthem right after this. It's over now. Stand by for the national anthem, please. Remain standing now. Take the national anthem, please. Thank you very much, Your Excellency, for launching the medical and trust fund. Mahama Cares is here to stay. Enjoy your journey back to wherever you've come from. We appreciate your time.
Leave. Leave.
Oh, you want to come? Let's go.
Sorry. All right, so the president just left us. His Excellency John just left us. He has launched the Mahama Cares, the Ghana Medical Trust Fund has just been launched. To all those who join us, thank you for joining us today. We'll meet in the afternoon for Petitia FIFA's demonstration this afternoon. So wherever you are, stay tuned for that demonstration live on Gold Coast Media. Thank you.
What